Hello, welcome back. I want to talk a little bit more about harm reduction and the principles of harm reduction. So let's take a look at a variety of harm reduction principles and see how it's distinct from abstinence-based models. In harm reduction, we're looking to reduce harm, not consumption. So the goal here, again, is not to encourage the individual to stop using, but to make the use safer. An example would be when someone's using, say, for instance, IV heroin. One of the strategies that might be used in harm reduction is to provide the individual with clean needles so that they're not sharing needles, or to allow them an opportunity to participate in a safe injection site. Those would be strategies that we would be using to reduce their harm, not to reduce the consumption of the substance. Another view of harm reduction is that active use is not pathological. In abstinence-based models, use is seen as pathological and needs to be eliminated. But in harm reduction models, we reduce the stigma associated with active use of a substance, and we encourage that it is not a pathological activity. In harm reduction, users are treated with dignity. They're not considered to be deviant, but they are treated with dignity. And the idea of self-determination is very important in harm reduction. So in harm reduction, we're not challenging, we're not judging, we're not confronting how much or what a person is using in terms of alcohol or other drugs. We allow the person to make their own decisions, and self-determination here, allowing the person to make those decisions, is highly regarded. Individuals are obviously then responsible for their own behavior. No one assumes responsibility for the activities or the behavior of the user. There are no predetermined outcomes. So some individuals may simply continue to use substances, and we would encourage the safer use of those substances. Some individuals may, unfortunately, overdose. Some individuals may move towards abstinence or recovery. There are various outcomes. So we have no predetermined outcomes in harm reduction, and those expectations are not put forth. And of course, a big concern that a lot of folks in the field have is that it's very difficult but it's not really at odds with abstinence. It can really be a part of the continuum of care. So individuals might engage in harm reduction strategies as a way to improve their recovery status. They may not ever achieve abstinence, but they might be in a better place than they would have been if they hadn't participated in the utilization of harm reduction strategies. All right, just a little more detail about the principles of harm reduction. If you have any questions, don't hesitate to reach out, and I'll see you in the next lecture.